Before I jump into that, I will introduce the organization a little bit more, as you said. So IP Global is an organization that works across like four thematic areas. The one that we work in, and I will also shortly introduce Mahika over here, is specifically the social, economic, and empowerment division. And there are other divisions like health, wash, and nutrition. And there's a third division on infrastructure and urban planning. And there's a fourth division on education and skilling. And the fifth division is on climate infrastructure. So we work across these thematic areas, which puts us in a very, strategic position where we can leverage these thematic areas and expertise to bring about a holistic change in the community. And we are specifically a developmental sector organization where we work very, very closely with the government in India and bring about technical support, assistance, and direct implementation on the field in order to bring those shifts and changes in whichever section we are working in and bringing those changes in the indicators. Specifically for us, I come from a very core public health background and have worked in digital innovations in the past. So we had an experience of working in a very large scale maternal nutrition program before we came across Glific. And that was the genesis or the nexus of this thought process on how and why a chatbot like this will be very helpful for our program, right? The program was basically working with more than 6 lakh pregnant and lactating women in one of the states of India, where the basic work that we were doing is basically social behavior change communication in order to improve the maternal nutrition and the low birth weight prevalence in that particular state. Now, the key interventions for us was mainly counseling and overall using various platforms, right, from interpersonal counseling to group counseling to media to social media, digital media, so there are multiple touch points in a woman's life in order for them to understand that what kind of behavior will lead to positive pregnancy outcomes. So what we realized during those 5 years, and rather my team, I was not there, but the team realized during those 5 years that it will be very, very helpful to have an interactive platform, because all of this work was driven by the frontline workers, as we say it in the developmental sector, who work very closely with the government systems and provide services directly at the doorstep of the beneficiaries that we are working with. However, of course, in India, we are a huge population, we are a very scattered population, and the number of healthcare providers, or we could say number of service delivery providers, in proportion to the number of beneficiaries is very, very low, right? So it is humanly impossible for every worker to actually meet the woman and provide those kind of counseling. So that is where the idea of a chatbot like this originated. And we thought that it would be very, very helpful to have a digital platform, which is not the technology and the digital, and somebody needs to be extremely, technology savvy for it. They're a very easy to use platform which is used in day to day. Something like a smartphone, a mobile phone, WhatsApp, etc., is used in a day to day life, and mostly like 80% of the even the rural population in India. So this idea of now using WhatsApp platform to deliver messages that are useful in their day to day behavior, especially during the 9 months of pregnancy, and not only that, but having a two-way communication. So the chatbot also provides the women to ask questions and give them answers based on the, in the life situation or the life cycle where they are. So it's a very interactive platform that we have tried to build so far. I'll stop here because this is about how we got into the idea of chatbot. But before I hand over to you, Aishwarya, I also want to introduce Maika. Maika Chaudhary here was also a part of the Launchpad experience that we had with Glific for two days last year, and she has been also very instrumental in actually building the platform. So as we go to the next steps, we will show you more about how we built it and what went through it. Nice to meet all of you.
Thank you, Jalpa. Thank you, Mika. Nice to meet you, like always. But just as a heads up to all of you, right? So both ABBF and IP started their journey of a WhatsApp chatbot implementation with Glific 1 year ago. Yeah, so all the learnings, everything that they're going to be sharing here is whatever they have learned over the past year since they started off with the Launchpad. So on that note, Prashant, I would love to bring you here as well. So what was the context at ABBF and what made you think of a WhatsApp chatbot?
Thank you. First of all, thank you so much, Aishwarya, for inviting me. It's a great opportunity for us to share our learnings as well. So, hello everyone. Myself Prashant, and at ABBF, Adventures Beyond Barriers Foundation. First, I will give you context what ABBF does. So, we are into disability inclusion. So, we work with person with disabilities as well as without disabilities. So, we try to create inclusive world for PWBs through sports and inclusive sports and expeditions. So, we do mountaineering, we do cycling, we do paragliding, we do rappelling, scuba diving. You just name it and we do it. Okay, because we know our social structure how it is. We don't have enough good infrastructure for able-bodied person. Forget about disabled person. If you think there is one wheelchair user, if he wants to get on a train or a city bus, just imagine in Bombay kind of city, it's impossible. We don't have enough infrastructure. So what we do, there are so many stereotypes within us. That doesn't mean we are bad people. We want to help PWDs. We want to help everybody, but we don't know how. So we chose sport as a medium so that people with and without disability people can come together and do the sport, enjoy the sport, and we create that experience so that everybody on the same platform. Nobody is like disabled, nobody is able, nobody is rich or poor, because whenever we play any sport, we don't care about differences. We just focus on that sport. We want to do this, we want to complete this, and that's our main philosophy. So we take sport as a medium, so we do all kind of these things. And in these events, so like जब भी कोई इवेंट होता है, एक गूगल फॉर्म निकलता है. You know how the process works. Google form means lots of questions, like 10, 15 questions. You have to fill that, you have to register for that event, and every single time you have to do that. And we have experiences. We don't call it event, we call it experience. So every single weekend we have these kind of experiences, and to register for this experience you have to register. That means you have to fill your details again and again and again each and every time. First, that is time consuming. Second, that is boring. Third, I don't want to come because I have to fill out the form. We do the same thing, right? It's a human thing. If I see 15 questions, I will say, okay, maybe next time, right? So ये सब जो क्लैरिटी, आई मीन केओस था, इसको थोड़ा सेटल करने के लिए हम लोग जस्ट एक लकीली ऐसे हुआ था कि एक ऑर्गेनाइजेशन का हमने बॉट हमारे हाथ में लग गया ही बोलो, हाथ में लग गया. तो हम लोग टेस्ट कर रहे थे कि कैसे हो रहा है, क्या हो रहा है. इट फेल्ट सो गुड एंड सिंपल कि कोई क्वेश्चन पूछ रहा है आगे से, व्हाट इज योर नेम? प्रशांत. वेर आर यू फ्रॉम? पुणे. अरे वाह, इट्स गुड ना. लाइक गूगल फॉर्म का कैसे एक स्टैटिक हो जाता है, थोड़ा बोरिंग हो जाता है, थोड़ा टाइम कंज्यूमिंग भी है, बट ये मुझे अच्छा लग रहा था, हम सबको अच्छा लग रहा था. वो एक प्लेटफॉर्म तो यूज कर रहे थे. फिर सोचा कि यार चलो हम भी करके देखते हैं, ऐसा एक कुछ प्लेटफॉर्म बना के देते हैं. सो वी वर लुकिंग फॉर अ ऑर्गेनाइजेशन और पार्टनर हु कैन बिल्ड व्हाट्सएप बॉट फॉर अस. बट अगेन, व्हाट्सएप बॉट का जितना भी हमने रिसर्च किया था, हमें ये पता था कि वो एक बड़ा सा ओशन है. अभी ओशन में जाना है, लेकिन पता नहीं लाइफ गार्ड है कि नहीं, पता नहीं मेरा एक छोटा सा पनडुब्बी लेके मैं जा रहा हूँ, पता नहीं क्या होगा. लकीली वी गॉट हर्ड अबाउट दिस ग्लिफिक लॉन्च पैड. तो चलो सोचा ओशन तो इतना बड़ा है, चलो थोड़ा स्विमिंग पूल में ही डुबकी लगा के आ जाते हैं. तो ग्लिफिक लॉन्च पैड फॉर अस काइंड ऑफ अ स्विमिंग पूल. पहले हम लोग स्विमिंग पूल में ही सीखे तो बेटर है ओशन में जाने से अच्छा. तो हम लोग लॉन्च पैड में गए स्विमिंग सीखने के लिए. इन अदर वर्ड्स, वो चैटबॉट का थोड़ा जानने के लिए. दिमाग में बहुत सारे सवाल थे, क्योंकि आई एम फ्रॉम नॉन टेक्निकल बैकग्राउंड. हमारे ऑफिस में भी बहुत सारे नॉन टेक्निकल ही लोग हैं, उनको भी ये आना चाहिए क्योंकि बैकएंड भी उसका बहुत इंपॉर्टेंट है. और जब भी हम लोग चैटबॉट, जैसे हमको कोई बैंक का मैसेज भी आता है, तो हम लोग जब भी उनको आंसर करते हैं उसका डेटा कैसे दिखेगा, दैट इज मोर इम्पोर्टेंट फॉर अस, क्योंकि डेटा डोनर तो मांगता है, राइट? और वो कंसोलिडेट डेटा होना चाहिए, रिप्रेजेंटेटिव होना चाहिए, अच्छे नंबर्स होने चाहिए, इनसाइट्स होने चाहिए. ये सारे सवाल लेके हम लोग लॉन्च पैड ज्वाइन किए थे. और वहां जाने के बाद फिर देखा कि यार ये तो जस्ट ड्रैग एंड ड्रॉप। जस्ट एक मेन चीज वहां पे इंपॉर्टेंट थी जो लॉन्च पैड में, वो फ्लो तो चलो बहुत इजी होता है, बट एक मेन चीज जो लॉन्च पैड में मुझे समझ में आई वो थी लॉजिक। फर्स्ट लॉजिक, क्या लॉजिक है? ये डेटा चाहिए, आप ये डेटा कलेक्ट कर रहे हो तो क्यों कर रहे हो? एक्सेसिव डेटा भी आपके लिए लाइक घातक है, क्यों चाहिए? वो डंप करके क्या करना है? सो जो चाहिए वही लेना है। वो चाहिए तो क्यों चाहिए? मतलब ले लिया है तो उसका क्या करना है, कैसे रिप्रेजेंट करना है, उसका यूज कैसे करना है? सो ये सारी चीजें हमने लॉन्च पैड में बहुत अच्छे से वो हमें समझ में आई। क्या, ओवर टू यू ऐश्वर्या।
Thank, thanks, Prashant. I think uh, based on what you and Jalpa, both of you shared, right? It already highlights something important, that the starting point is usually a real operational or an engagement challenge. And it is not the point of we want a chatbot for the sake of it, right? So both of you saw a problem and both of you saw like a solution of a WhatsApp chatbot, and that's when you took a deep dive into it. But that brings us to the next part of our conversation. But before I move into the next part of the conversation, I would like to read the room here. Are all of you comfortable with Hindi English mixed? Or would you like the entire webinar to be in English or Hindi? Please let us know by dropping your preference on the chat. If anyone is not comfortable with Hindi, please let us know on the chat. Fine with both. Both works. Okay, completely in English would be very helpful, Nitya.
Looks like it's a mix, Aishwarya, like somebody only comfortable with Hindi.
Okay.
Like
Can
maybe
only understand English. We have Sheila who's joined in from Shofco. Okay. So is it, Prashant, is it okay? Jalpa, is it okay if we keep it only in English?
Sure.
Yeah. Okay. So
Aishwarya, we have one only for Hindi. So maybe just any important points from their conversations, if you can reiterate in Hindi also, it will be helpful. Like,
okay. Okay. Yeah, all right. Thank you, KP. So on that note, I think uh, I think a lot of organizations stay at this sounds interesting for quite a while, right? So I would like to understand how both of you moved from thinking about a WhatsApp chatbot to actually implementing it. So now you saw a problem statement, a real challenge, and then you thought of implementing a WhatsApp chatbot, and then you joined the Glyfic Launchpad. But what was the process of actually implementing it look like? So Jalpa, maybe we can begin with you here. So at what point did you feel that you needed a more structured support? And what helped you from basically discussing the ideas internally to actually actioning it out, testing something?
Sure, Shwarya, thank you for that. Interestingly, I will start off a little bit about our experience and also echoing what Prashant mentioned. That See, chatbots are available at various levels. Previously, also, we have developed an interactive IVR system or a chatbot system on a certain platform. But like he very rightly said, if you outsource it or if you build it on a very technically, complicated system, it is very difficult to bring continuous, evolution in the flow as we go ahead in the journey of implementation. Also, an organization like ours, we were working in 10 states. Our plan was to work with in 10 states. So the journey, the context, the design, the content, because it's about nutrition, will also be very contextual to the state. So it was very important for us to have a platform, which I would say that was just served to us, where we had complete control, and it was as easy as just shifting arrows if we had to shift content for a specific state. And we had also tried doing that. The other very, very important thing about this platform, second component that I feel is very important for organizations, is the integrated use of e-Bhashini, right? Because again, we have multiple states that we wanted to work with. I'll just give a disclaimer first, we have not gone completely on ground with implementation so far, because we work very closely with the government. So there are a lot of processes and approvals that will happen. However, we want to be prepared to be at least be able to do a state in South, a state in West, and a state in East, and a state in North. So we could very, very easily integrate e-Bhashini in our chatbot because of the functionality that is available on Glific. The third thing is that since we are working with extremely rural population, mostly rural, the urban population is very, very low in our catchment area. We also wanted the audio conversion tool, which in any other chatbot is it's a very big functionality or a feature to have. However, here, again, with every text message, we were able to convert it into an audio message. So that is something that we have kept right now. Of course, when we implement it, not every message will be converted to audio. However, there is an option for the user that they want to listen, they can listen to it, which I feel is extremely, very, very, evolved. It's very, very user-friendly and so adaptable to the region and the population and the context that we want to build in. So these were the 4 components which I felt are very unique to Glific as compared to what I have seen otherwise in other chatbots and also my previous experience with an interactive platform. When it comes to from thought to implementation, I was just telling Prashant here that our journey was very different. When we came to the Launchpad, we had an idea, we had a problem statement, and we knew that we needed a chatbot for communication with the pregnant and lactating women in India, who's from the rural part of India. However, we didn't have any idea about how the flows will be, how the content will be, what the logic should be, how big or how small or how easy the flows could be, right? So when we came to the Launchpad, we realized that all these functionalities are already inbuilt in the platform. So our major focus during the Launchpad was to just get the technical part of it right. We did not focus a lot on the content, and as it was advised by the mentors over there as well, one of them being Aishwarya. And that really helped, because by the time we went back, we knew that how this chatbot can be used with the context that we want. After we came back is actually when we started sitting in the closed room, went back to the blackboard and churned out the whole flow for our chatbot, which right now has become very extensive and expansive, and we definitely want to cut short. But right from the pregnant woman to the healthcare worker to the frontline worker and to even the families and communities is a very, very big component of communication for our program. So we started building it from there when it came to implementation. And then we had a very, very extensive, a very, very scientifically backed up, literature reviewed content document. And we didn't worry that how the messages will go or what will be the format of those messages, because obviously in a chatbot you cannot give stories, but we developed our note or the content in a way which is scientifically very, very updated and also relevant, and because it's a very critical area that we are working in, right? So we didn't want to send any messages which could be harmful in any part of India. So the first thing that we did was to develop a very scientifically correct content note on the chatbot. And then we went on to see what our flow will look like. And then we tested and tried it, I think about 50,000 times. And there were so many glitches even while we were testing it internally. We did try it with different people in our office. And then finally, the content part was very much fixed. The flow was very much fixed. The categorization was very much fixed. The features of AI ML, e-Bhashini and audio conversion were very much integrated into the flow. And now what we are working on is specifically conversion of the long messages into very easy to understand and a conversational way of messaging, and more infographics, more videos, more statics, rather than having longer messages. So our journey was, I think, very, very meaningful, because we learned a lot about the communication protocols on how the chatbot can be best used in this scenario. And the other thing we learned was that this chatbot is very adaptable, right? So I could make one flow just for Maharashtra. I could make the other flow just for Rajasthan. I could make the third flow only for Karnataka. So in that way, it was very, very easy for us to envision and to plan implementation in various parts of the country. However, we have not still gone on the ground for that.
Very interesting, especially on the point of where you mentioned that you realize that voice was the actual mode of communication by the user research, and that's when you decided that that is the feature that you want to have on the chatbot. But just like a small note to everyone there, Bhashni is not something that we use anymore. We use and Gemini, and we have integrations with 11 Labs and Cyberm as well. Just that because Bhashni was giving some issues, we've translated into it, but it does say Bhashni webhook on the UI still. But thank you so much, Alpa, for sharing that. So Prashant, how was your experience? Did your team approach this from feature first, or how did you approach this?
So initially, we just wanted to replace Google Form by a chatbot. It was very simple. But if you can ask me now whether we are using only that function, I will say only 30% is our registration process, and 70% we have thought of something else only. So right now we are doing reimbursement from our WhatsApp bot. We are, the WhatsApp group have now replaced by WhatsApp collection, the bot collection we made. So everything has changed. Okay. So from the idea, when I came to the Launchpad, we only thought of we just want to replace our Google Form and Microsoft with the bot. That's it. And we did that. But after the Launchpad, when I came back from our Launchpad, we had an internal discussion. We brainstormed these things, and we found that there are so many things. So just like one thing is like multilingual. We can make our bot multilingual. That was a relief for us because many of our PWDs are from south part of India, from Tamil Nadu, from Kerala, and we have language barrier there because we cannot speak in Tamil and they cannot speak in Hindi or English or something. So there is a language barrier. How can we overcome that? In Google Form, if we want to translate that form will take a hell of a time. Like 5 languages, if I want to integrate in a Google Form, like choose your language first, then the form will be lengthy for us. Internal working time will be more for the Google Form. So that was relief from the Glific side because it's multilingual. That is one. And second thing, for every event, we have around like 200, 300 participants. So what we have to do after when they complete their registration, we have to add them to a WhatsApp group to send the communication related to the event. But now what is happening? We just added them to a collection of that particular event, and we can just broadcast a message and they will get a message. Right? So adding to a WhatsApp group is a different kind of a challenge because we know somebody will turn on that setting, invite only, then the link will go. He will not see the message, then the link will expire. Again, follow up. We will have to take follow up by the link. Please accept the invite. Please join the group. So these efforts have been made easy by the chatbot, what we have built with Glific. And also, as I mentioned, that we are also doing internal reimbursement system on the bot only. That's our version 2 actually, but we are working on that also.
Very interesting. Something that you wanted to implement externally as well. You found use cases for internal communication also, which is very nice, Prashantji. I think that naturally brings us to the implementation side of things, right? So now actually coming to the implementation journey, Prashant, maybe for this we can begin with you. Since you've already piloted the chatbot,
Yeah.
right? So how did you go about converting the idea into an actual pilot? So, and how did that process look like for your team? Like, how did you put together the content, think through the process of how it was manually being done, and then how did you reduce that barrier through a chatbot? I think there's also a question by Sanjana on the same, but I'll first let you answer this and then bring it up.
Sure. So before Glific, actually we had that idea that we want to build a chatbot, and we explored few options in the market also, and we found one. We worked with that organization for a year and a half, 1.5 year, and still at the 1.5 year we could not able to complete the bot flow. That was very frustrating for us because we spent time, we spent money, because internally we used to do discussions on this, how the flow should be, how it can be how it can be user friendly, because we can make a flow in our office, but there is a big difference of you can make a flow and the user can use it. Like there is a difference. User can have something different expectation from the chatbot that you cannot think of, so that you have to like imagine everything, you have to test it. As Jalpa said, she have tested it thousands of times, so you have to test, try and test. So we did the same thing, but when we sorry
the Indian social I guess there's some issue.
Yeah, good.
Oh, sorry. So that's what we did when we got into connected with Glific. So Glific, when we started working on the flow, it was very easy. As I saw in the Launchpad, it was just drag and drop. But when we actually started working on the chatbot, I think it was ready by 4th month after our collaboration with Glific. And here we spent 1.5 years, and now I can see the difference clearly that we have completed our chatbot first project, version 1 within 4 months. So it was really easy because also Glific team also were involved in that process. They were also giving us suggestions. Even Krishna, she was very particular about what we wanted. We wanted to have Google location, pin code initially, but she insisted on to take current location. I know that she was kind of fighting with us, not like actual fight, but she was putting her head down so that we could not do anything different. So that also we found it very useful inputs from the Glific team. It was very useful for us in our journey, in our bot journey.
Thanks, Prashant. I think what I would also like to clarify is the journey that IP Global and ABPF have gone through post Launchpad is slightly different, because ABPF took a consulting project with Glific, and IP have been developing the chatbot by themselves with the support of the Glific team on the side. So on that note, but definitely for sure the kind of problems that you face, I think a lot of organizations here as well can definitely relate to. So on that note, Jalpa, your team is currently still in the implementation phase, like you said, right? So it's a pre-pilot phase. So I would like to understand your perspective as well. So how has this implementation journey looked like so far? You did briefly touch upon previously. So, but I just want to know what has been the biggest decisions that you have taken while designing the chatbot. What were those learnings that you came across when you did that 50,000 kind of trials? Hey, am I audible?
Yeah, you are.
Okay. I think Jalpa is okay. While Jalpa connects back, I think what I missed was Sanjana also had a question, Prashant. So could you please share the chatbot engagement statistics on daily/weekly/monthly basis? So do you want to answer that question?
Yeah. So it's our chatbot like engagement is only weekly, because whenever we have an event, then only people get on our chatbot. We circulate a message like with a keyword so that they can register for that particular event. So around we have right now we have around 200 to 300 participants per week. Okay, and in the month of, like, let's say October to February, we have more engagement because we have a bigger event in that particular month. So the engagement will be around 700 to 800 per participant per week in that peak month's time.
Understood. Okay. Thanks, Prashant. On that note, Jalpa, do you want to help us understand your implementation journey?
No, absolutely, and we are also happy to show one of the screen recordings of the platform. That I'm happy to take suggestions, comments, and any other feedback that you guys have. But yeah, in terms of our implementation journey, like I said, it's very, very interesting because I can give maybe one example without stating the name of the state or etc. But we have been meeting multiple decision-making bureaucrats and government officials, in the Department of Women and Child Development, and we hear the only requirement right now, if we go as partners and if we go as collaborators, is mostly around digital platforms, and it's mostly around getting information from the field, getting real-time case stories, which is very easy to translate into evidence at the state level and advocate for it and disseminate about it. And third is also about just knowing that where are these people where we are putting services out for, right? At the government level, at the state level, there's a lot of schemes, there are a lot of programs that are running, there is a lot of money that is getting invested. But getting real-time insights into it getting translated into stories is something that we don't have so easily. We don't have such platforms. So one of the major asks in our understanding has been about having a digital chatbot or a platform of sorts. So we see a huge potential in terms of acceptance and in terms of implementing in a few states and then expanding. There are also other players in where we are working in the with the lactating and the pregnant women. There are other players who have been working on the chatbot. But what we see as a very unique difference with this chatbot is that it is a two-way communication, whereas a lot of other chatbot platforms are a one-way communication. So there are continuous messages and nudges going. But if there are some asks or if there are some questions or some data related, there's no way to take that. So I think how we are pitching it, our major stakeholder is the government officials. So how we are pitching it and how we want it to be implemented puts us in a position which is very, very acceptable and flexible. The only thing that we feel could be a challenge for us, based on our understanding right now, is that our primary beneficiary is the woman, the pregnant woman, or the woman who is before pregnancy or after pregnancy. And our aim is to use chatbot as a touch point of communication, because there has been evidence that more the touch points of communication, better the behavior change practices and better the outcomes of pregnancy, is a very tried and tested model. A problem here hai ki a lot of women in India, in the rural part of India, do not have their own phones and do not have their own smartphones. They have a family phone, which is common to the household. They get access to it, say, probably evenings or nights when their husbands return back home or their children return back home from colleges, but they don't have it throughout the day. So that's one of the bigger challenges that we are trying to deal with and understand. But that will not be 100% of a population. And if you want, Aishwarya, I'll also ask Mahika here to talk about a few points in terms of what could be the potential challenges while we were developing it, and a lot of feedback that we were getting from our teams. And also we can show you one round of the how it's running right now.
Yeah, definitely. Mahika, go ahead.
Yeah, so I think this is something that Jalpa has already talked about, but just the content side of it, about how like factual it needs to be. That was obviously like a pain point. Like we've gone through it a bunch of times and now we are fairly confident. But I think one place where I would like to highlight where it's actually helped us a lot is in the AI/ML models, where you get to train your agent and how to get it to hallucinate less, because we cannot be spreading misinformation. So I think that is also something that has been very helpful. And one more thing that we were kind of thinking about doing, we haven't gotten to it yet, is about geotagging locations and stuff like that, so that we could get a better idea of like how we could. So every single day that I think we go on this, and every single time we do this, a new question arises, like how can we make this better? How can we make it more efficient? How can we make it more helpful to the beneficiary? Which is why, so we've been thinking of new innovative ways to target them, like new ways to reach out to them.
Yeah.
So I think that is also something that we've been looking at. So far, I think we are very excited to pilot. I think when we go on the ground, that is when, as Prashant has already said, that I think that is when we're gonna get some real insights. But yeah.
Yeah, I also want to add that for us, recruiting the beneficiary on the chatbot is also something that we have sorted out, because we are already working on various platforms, the MCHN days, the VHSND days. There are some community-based events that happen at the community level, and this is a place where the community engages in services that are given. So one of the very easy ways for us to link ourselves with the direct beneficiary, which is the woman in this case, are going to be these platforms where we are already providing support, technical support in terms of training and overall counseling. So, it's a very good use case for us. Second thing I also wanted to mention was about data. So the new DPDP Act that has come into place has put us in a very unique situation where taking or capturing any any data without the consent of the user is going to be an illegal thing to do as per the DPDP Act. So that's another thing that although we do take a consent that are you okay to share your information and are you okay to hear more about nutrition based on the answers that we receive from you. But there are very strong systems that are coming into place at the organization level for DPDP. So that's another challenge. Having said that, the BigQuery platform that we have established and we have also integrated, we have already tried and tested over there, and we are able to look at whatever tested data we have, whatever piloted data we have, we are able to get the analysis in a way that we understand in terms of our reach, our engagement, our people coming back onto the platform, how many people are coming back to the platform, about how long the conversations can go for each individual. So these things we are able to use, but this will remain a question for us as to how the DPDP Act applies for the chatbot here.
Perfect.
I think there is a question for us from Aditya from Central Square Foundation.
Yeah.
Do
Aditya?
you want to take it, Aishwarya, right now, or?
Can we take it at the end? Is that
Yeah.
okay? So I just want to, like, one highlighted thing that I want to basically my takeaway from both of what both of you shared was one thing is that I think both of you have put an effort to ensure that the bot is very user-centric in nature. So maybe with respect to the barriers that Prashant mentioned in terms of people not registering to the events, or maybe with respect to single phone per family or voice first approach, and also the timings right now that you mentioned, Jilpa. So all of these are, I think, surrounded around how users can find it more easier to interact and engage. I think that's user research plays a very important role in cracking the engagement part of it. So that is my takeaway here. But yeah, Aditya, I'll just open the floor for questions by just one closing statement from both of you, just also in the interest of time. So Prashant, how did your community respond when they first interacted with the chatbot versus the Google Forms that they were using?
Actually, it was very simple for them because most of our participants are blind, and WhatsApp is very much accessible than Google. Very accessible. People don't know how to fill out the Google form, but they know how to use WhatsApp. So our bot can ask a question and they can just respond to that question. As simple as that. So it was very, very interactive for them also. Even we created some nudges like birthday wishes, even upcoming events. So people can come on our bot and they just look for upcoming events. which are the events are going to happen in future. So they can register in like advance only. They can show their interest also. So I just want to mention one thing that I think very important. So we have different events. So we have different flows for different events. Now, again, it's a task to create a flow for every event. Sometimes on like some weekends, we have multiple events on the same day. So it will be very difficult for our team to create those flows also. So what we have created, we have made one Google sheet and we scripted that with a JS like JavaScript. We written that and we create automated flow. We just have to mention our event details in that Google sheet and just run the script and the flow will be automatically generated backend. We don't have to open our Glific account, create flow, copy flow, nothing. Just put event details into that sheet and just flow is created. Boom. As simple as that. So yeah, so participants are excited. They feel easy to fill out the bot form. Our team is excited because we don't have any work to do. We don't have to add anyone to the WhatsApp group. We don't have to send any like Google form, nothing. The workload is less now. So we are also happy. Our participants are also happy.
That's great. Especially love the idea of the app script, Prashant. Like I already mentioned the other day, I think we are trying to put together something, a blogger, something that everyone who's in the community can use wherever they find it relatable. So on that note, I want to open the floor for questions right now, and then we can probably see like a small video of both of your bot interactions so people can relate better in terms of whatever you're speaking of right now. So Aditya, over to you.
Hi. Hopefully I'm audible. Thanks, team, for sharing. It's really interesting to see the various ways to deploy in the social sector. So the question for IP is, considering that you're also collecting information from beneficiaries, what considerations did you make, or how did the chatbot help in addressing maybe under-reporting or over-reporting on anything you want to collect from a beneficiary? Like, has it had an impact on that side of things?
Just trying to understand because your voice was not very clear, but what you're trying to ask is that while we were collecting information from beneficiaries, were we taking
Yes.
into consideration any of the underreporting or overreporting factors for whatever information, right? That's what the question is.
Yeah. If the chatbots helped that side of things?
Yeah, so the whole quality assurance in this particular chatbot starts right from the recruitment process, right? And chatbot is not something, it's not like it's not a service where you can go through the eligibility and you can remove people from the place. So it's an open place where people are able to seek. It is possible that I am not a pregnant woman, I'm not a lactating woman, I'm a 50-year-old woman, or I'm a 14 or a 18-year-old girl who is just keen to know more about what happens during that phase. So that is not a filter that we have as of now. However, it is a self declaration that I am a pregnant woman, or I am a healthcare worker, or I'm the family of the pregnant woman, and this is how we enter. Age consent and age declaration is something that we are taking as per the standard norms, that you say that I have been above 18, and if you're under 18, you're not allowed. So those things we have put on the chatbot already. And it is the recruitment process mainly, right? What I said in the beginning. So how you start recruiting people on the chatbot, like I said earlier, we are planning, because we have not yet gone on the field, but we are planning to use the same platforms where we find the community engaging with the service delivery mechanisms, mainly the VHSND days, the community-based events, or Anganwadi centers, or healthcare centers like CHC, Ayushman Arvind, etc., is the place where the mothers or the pregnant women or lactating women come for services for ANCs or for their supplements or for the immunization. That's where we will recruit our beneficiary. So that's the first place where we assure that those who are coming onto the board and those who are declaring about their status are there. The second point, we are not taking any data from them in terms of how many weeks or how many months or their their blood profile or their any clinical values, we are not going into that, right? Because once you start collecting, and like you rightly said, we cannot rely on that data unless there is a attachment of reports or something like that. And the moment you get into that process, people are going to start getting out from the chatbot. So idea is not to give them clinical advice. Idea is not to give them therapeutic advice. The idea is to give them plain behavior change information on maternal nutrition and the services available in the vicinity. And then we have an AI/ML system where we have enabled a interactive question answer format, again within the given guidance of the document that we have created the content flow from. So that's, I don't know if I was able to answer your question.
And just to add, at any point, if like they stray away from that conversation, or if it gets too deep about, oh, like I am having this issue, I have high blood pressure, what should I do? The chatbot has been trained to not be too prescriptive. So
Yeah.
the only suggestion that we'll give is go to your doctor, go to your nearest A&M. Do you want me to give you the nearest A&M location?
Yeah, that's great. Did that answer your question, Aditya?
Yes, it did. I was just curious if after the first level of contact, after the first touch point, do they go back based on the data collected again to the beneficiary? So again, I think that's depending on the data, quality of data that we are getting from the beneficiary also. The mono a beneficiary has engaged with the chatbot. We've recognized that's a person that you can give X advice to. You then go back to that same patient with another push message or trigger another flow to then check if they've used the advice in some way or not. So to close the entire loop of engaging with that beneficiary.
I think the larger idea is also not to replace human touch, but to mostly supplement and support it.
I got it. Thanks. Thank you.
All right. So on that note, Jalpa, you want to go first by sharing the recording of your board?
Yeah, I can do that.
Yeah.
Monica will take us through that, and I will share my screen. Just let me know if you are able to see my screen, and yes,
Yes.
and if I'm playing, is it playing for you? There's no audio.
Okay, it is. If you want to
Okay.
run them over the board, please feel free.
We'll do that. While it's playing, we're going to do that.
Yeah.
Okay. I'm just gonna start it from the beginning. But so basically this is a recording of my phone because we just wanted it like to make other people see what it's looking like on somebody's screen. So this is what we're thinking of starting with. We created a persona for our chatbot, which is something we learned is a good practice during our Glific workshop. So that is what we're going with to create some identity for our chatbot. Then before we continue, we'll take consent from the user. After they have given their consent, we'll ask them what they are. So we have three, right now we've created flows majorly for the pregnant and lactating women, but going further, we're thinking of creating also some informational guidelines for the family members and for ASHA and A&M workers, so we can extend our beneficiary base that way. And then these are the broad topics that we're covering. So there's nutrition, ANC visits, trimester information, exercise, gestational conditions, postpartum care, cash scheme, and myths and misinformation. So again, all of it is very not prescriptive in nature, very informational, very counsel-based advice. Then once somebody clicks on nutrition, they get like a brief overview because we understood that because our chatbot is so information heavy, we try to break it up as much as possible. We still think that it's quite lengthy and we're working on breaking it down a little bit more, but this is what we're starting with. So giving them a brief overview of like what to eat and like, because we don't know if the user is going to click on this said information going further. So we just want to give them the basic gist of it in the first place. And then again, weight gain information, the most important information is displayed first. And then after that, they get to choose.
In this case, they chose under nutrition, they chose about the diet chart.
Diet chart.
So now the next steps on the diet chart will come.
Yeah, so this is something that we designed. So it's basically, we're trying to, again, to cut down on the content, we're trying to make as many infographics, videos as possible and to supplement that instead of text. So this is one case which we wanted to show you guys.
And then we have the option to either go back to the nutrition menu, which has many other submenus, or to go back to the main menu, which had other components besides nutrition. So after every message, there's an option for the user to go back. If they're already bored on one topic, they can always switch and explore other topics.
Yes. So in this case, we're going back to nutrition, and then once again, the menu options are going to pop up. And then this time, the user has chosen supplements. So again, a brief overview of supplements will follow. Like this is an intro text that this is, you should take IFA, you should take calcium. And then if they want to know more, they can click on yes, or they can even choose to go back to the main menu. That is up to the user. Then we have some more details on IFA and calcium.
We talk about the dosages and how to take it, when not to take it, with what to take it, which are the biggest problems on the field. Is we also did a little bit of field data collection before making this content, that where the problem lies, what communication is important. So this is not just picked up from the guidelines and put over here, but these are from the gaps that we see in the communication right now. Very simple example being people take iron tablets with milk, or people take iron tablets with calcium tablets. That is a very wrong practice that is very, very commonly seen on the. So we are specifically talking about when to take iron, how much to take, and with what to take, and when not to take also. So that's how it is customized based on the current gaps.
Yeah. And then asking them again if they would like to know more, and then various options based on what they choose.
So say, for example, their problem is mostly, they now further want to go into iron, calcium. These are the three major supplements that a pregnant woman has to deal with. So if they choose, okay, I want to know more about iron, like specifically iron deficiency is a problem that they have understood during their ANC visit from the doctor. So now what can be done at home, and what kind of food supplements besides taking the IFA supplements are important to improve the iron nutrition amongst them. So then there will be a, obviously, when we go on the field, this information will not be seen in such a text-heavy way. This is currently the best content that we can have, but this will be converted into more, AV routes.
Yeah, and also, like, I would just like to highlight that on every point of this, there is an option for the user to just type their question directly, or to, because like in case they don't want to like keep clicking on buttons and then receiving messages, they can always send an audio or text.
And so now we're just showing that we can also always go back to the main menu, and then these primary lists will appear again.
Yeah.
So the user can keep playing around with it. And also at the same time, if there are any open-ended questions, like she said, they can just type it. If they're bored of selecting so many options and waiting for the entire flow to get over, they can always just type in the question. And then the bot again asks them, okay, do you have more questions, or you want to go back to the main menu? So the user has a follow through at every point. After about 5 seconds or so, if they don't, and if they say we want to end this conversation, that's where the conversation ends.
Yeah. Thank you so much, Jilpa and Mahika, for sharing a glimpse of your chatbot with us. If there are any questions, like Krishna said, please add it on to the chat window here, and we will take them one by one. In the meantime, Prashant, over to you to share like a quick glimpse of your chatbot. You're on mute, Prashant.
Oh, sorry. Sure. So the UI is slightly different because I use simulator, the Glific simulator. That is why it is showing like this, but it's not like that. The AB, it's proper actually. Because all the phone numbers are already registered as a user, so we cannot create our profile again. So that is why I have used simulator. So whenever we send hi, hey, hello, this message, the flow will trigger the profile flow. Whenever the user comes up at our platform first time, then we just click start and then choose language. It's multilingual so that any language can be incorporated here. continue, and we just ask full name. We take basic details, which details we required for our program. So like you can see there are three options. One is I have a disability, ally slash able-bodied person, and caregiver to a PWD. So disability is only for PWDs, ally is a sighted person or non-disabled person, and caregiver to a PWD, that means any person who cares for a PWD. Like my mom is a PWD or my brother is a PWD and I'm a caregiver to that person. So I choose this option, caregiver to a PWD. So flow for every option is different. For a disability, there is another flow. For able-bodied, there is another, and for caregiver, there is a different flow. So here I choose I have a disability. Once we select this like option, we cannot change later. Because if I have a disability, I cannot be non-disabled after 1 year, right? So we cannot change that. So we can select our disability type, date of birth, then email address, then gender, PIN code. PIN code is essential for us because we just want to know where are our participants coming from, like geographical. We need to know these details. So once we complete these details, it will ask whether these details are confirmed. If we say yes, then it will offer these offerings we have for PWDs. So first is outdoor inclusive sports. In this category, we have different sports like running, cycling, paragliding, everything, scholarships, entrepreneurships, jobs, and talk to us. So once we select outdoor sports, so there will be a list of activities we do. Once they select any kind of activity from this point, they will get a notification from whenever the activity is scheduled. Okay. And also we have one option called upcoming events where people can see our upcoming events so that they can register directly from this list. Yeah. So we have Run in Sync, we have Leh Pangong Ride, NMDC Hyderabad, we have weekend cycling, paragliding, these kind of event they can see. So whenever we have an event, what we do is we create a WhatsApp link with the keyword so that people can click on the link and just register for the event. If the participant is coming first time, then the participant have to go through this flow. And if the participant is coming second time, like first he have completed his profile, his or her profile, then he don't have to complete the flow. So it will start like this. Just enter the keyword that you don't have to actually because we have that link directly and just interested. So these details, I have forgot that video to record because these are event specific details. If you're a first time user attending any first event, you have to fill these kind of details also. That blood group, your emergency contact name, your t-shirt size, these details will be only for the first time. And after that, this is like second time the user is coming. So that is why after interested, it is asking for to confirm your details because the details bot already have. When I just click yes and waiver and consent form and you are registered. That means if you are a second time user, you have completed your profile for next time, you just have to click 2 times and you are registered for an event. You don't have to fill any kind of details. Yeah. Over to you, Ashwin.
Thank you, Prashant. I think then the participants have really appreciated the effort of not filling out the entire form once again. So this is great. So thank you both once again. I think this conversation has been very helpful for the organization who've attended this webinar. I think that most of them are able to relate to the problems that they are facing at their organization and what it looks like as a entire journey for taking an idea to pilot and then into an implementation journey. What are the things involved there? So thank you so much again for making time and sharing your experiences and learning with all of us. So I think most of you heard Jalpa and Prashant take the word launchpad multiple times. For anyone who feels that a launchpad might be like a relevant cohort at this point, your organization, I'll just quickly share about what a launchpad is, and I'll definitely share more on the email after once the webinar is also completed. So it's happening on the launchpad is again open this year, and it's happening on June 22nd and 23rd. So it's a 2-day hands-on virtual workshop. We are doing it virtually this time to remove barriers for organizations to travel. And so it's a opportunity for organizations to build and launch their first chatbot. So the focus throughout the Launchpad is going to be about building chatbot flows, understanding the platform capabilities, and then translating whatever you have learned theoretically into a working prototype that's your chatbot. So it will also follow up with a 1 month of guided implementation support to help organization move from the initial chatbot setup to a live pilot. So I will share more details about what are the benefits and things like that on the email. So just sharing a quick poll here to understand how many people would be interested in getting this information about the Launchpad. Krishna, I think I transferred my ownership of the uh, the host ownership to Jalpa. Can you give me the ownership so that I can quickly share the poll?
I'm checking now. Don't think I have the access.
Okay, Jalpa is
Do you want me to push which post? Which poll? AI enabled, sorry. Is there a name for the poll, Aishwarya?
Yeah.
Aishwarya, I made you the host.
Okay. Yeah. I think that's helpful. Yeah. Yeah. If you're interested in signing up for the Launchpad, please. Thank you so much, Prashant and Jalpa, once again. If you would like to share any closing thoughts, we'll hand over the mic to you.
I would just like to say, on behalf of the organization and Mike also sitting over here, is that I think it's important that the idea is translated into a product and is implemented, it's piloted, and a lot of feedback is taken from the user in the very initial stages. And in that case, the Launchpad is really going to be very useful. Also, it is very important to keep pestering the mentors, because there's a lot of features and functionalities that can be explored and integrated into the platform that can be very user friendly. So we should definitely, like the upcoming batch can also focus on that. And the third is to have a very strong rationale, because this cannot be for everyone and anyone. It has to be very focused in terms of the target group that you want to work with and the outcome that you want to achieve. So it'll be very important to have that focus cascade of what you want from the. But overall, I also want to thank the Glific Group, give us the opportunity to attend the Launchpad, use the platform, and constantly be with us while we were developing it. Also, we had a lot of opportunities to interact with them. Although we were not in the consultancy mode, but we still got a lot of help and a lot of mentorship from them throughout this process.
Thank you so much, Jalpa, and would love to see how you take this forward, and would love to learn more and hear more about how your implementation and pilot journey actually went. But thank you for sharing that very grounded, practical advice for everyone who are looking forward to it. Prashant, any closing thoughts?
Yeah, I think before implementing or before even thinking anything, just think for a logic and think for a simple question: why? Why and how much? Why I want a chatbot? Why I want this data? Why I want that much of data? Why? It will resolve all your problems. It will help you in Launchpad. They will also guide you why and how. But I think homework is very important. Before going for a Launchpad, you can think why I want a chatbot. What is the use case? Uh, uh, what are my, like, who are the users, right? So these kind of thing, if you can think beforehand, it will help you in the Launchpad. And technical thing, it's very easy. It's very easy. Glific team is there. They can help you with that. And it just a drag and drop thing. I'm telling this again and again because it's very easy. Building flow, it's easy. It just need a logic and a big why. That's all from me.
Thank you. Thank you so much, Prashant. All right. So I'm going to end the poll. Anyone who wants to get started with the Launchpad can reach out to me after I share an email. Any questions? The floor is open. Thank you, Nirmala. Glad to have you here. Any questions from anyone? Please feel free to unmute yourself and ask as well. If there are no questions, feel free to drop off and you can hear back from us about the Glific webinar resources and the Launchpad as well. Thank you, Saraswati. Thank you for being there.
Should we log off, Aishwarya? Are we ending it?
Yeah, if no one has any questions, I think we can. Thank you so much, Jalpa. Thank you, Prashant, once again.
Thank you.
Thank
Thank you,
Thank you,
Aishwarya.
everyone.
Thank you, everyone. Thank you.
Thank you,
Thank you.
everyone, for being
Thanks,
with us.
Krishna. Bye.
Thank you,
Yeah.
Prashant. Bye. Good to see you.
Bye.
Thank you so much, Krishna.
Thank you.
Thank you, everyone. Bye-bye.
Krishna, you want to stay back for a minute?
Yeah. You might want to stop the recording.
Yeah.
We can connect, post this like on a
Sure.
separate link probably.
Sure.
I'll send you the link.